News Talk on demand. Interruption-free audio where you want it, when you want it.
I'm John Gormley. Welcome and thanks for checking in here. With the highest rates of multiple sclerosis in the world, I think it's the Orkney Islands, or one small group of islands may have a higher area than us. Saskatchewan tops the world per 1,000 people of multiple sclerosis patients. We don't know why. So in Italy, and we've talked about this many times, a doctor develops a theory that he believes that blockages in the head and neck veins that prevent blood from properly draining into the brain is a central problem with MS. It's called CCSVI, chronic cerebrospinal venous insufficiency. 2, if you put a stent in some of those veins and open them up, called the liberation therapy, it can ease the symptoms of MS. The Saskatchewan government, 2012, pledged $2.2 million to send 86 MS patients to Albany, New York, to participate in a large 2-year clinical trial of the CCSVI treatment. In the meantime, at McMaster in Hamilton, they take 100 people with MS, 100 people without MS. They do deep vein scans in the necks and the heads. And according to Dr. Ian Roger, a lead researcher, quote, "We find, quite frankly, we were astounded at how clear-cut the evidence was. There was no blockage. No difference between the two groups." So this casts some questions on the role of this CCSVI and multiple sclerosis. Dr. Bill Code is a practitioner of integrative medicine, a longtime anesthetist, who himself has gone through the journey of having MS. And we find Bill Code on Vancouver Island this morning. Bill, thanks for taking our call again.
Yeah, good morning, John. It's good to be on the program with you.
Now that you see this McMaster work, there are a number of research facilities. There's Buffalo, there's Albany, there's all these different things. What was your first impression when you saw the research from Hamilton?
Well, I wanted to look at how it was done, number one. And the second thing, I knew right away when I read even the first line that it was only done with ultrasound, that I was concerned about that as well, although they did do some with regard to scanning. So there's a couple of really important things to learn when you look at the drilling down into the study. And it was well commented on by Dr. Paolo Zamboni, who initially you well described earlier, came forward with the hypothesis out of Italy. So first of all, the leader of the study is not a neurologist. He's not a vascular surgeon. He's actually a chest physician or a respirologist, which always concerns me a little when now he's an expert on veins in the neck as well as multiple sclerosis. The second part that concerns me just a little, and maybe it's a good thing, is that, he has a very strong drug company background, because I think we're just now starting to see the outcome of this new paradigm shift of relative venous blockage draining the brain being an impact not just in MS, but in other illnesses of the brain. In fact, now there's several research articles talking about these small veins draining the brain and head, and the small veins are more dominant in 3 groups of people: those with migraines, multiple sclerosis, and traumatic brain injury. So when you've got an industry that's already doing $30,000 to $50,000 a year for tens of thousands potential people in Canada and hundreds of thousands in the United States, then you start to wonder, maybe we're starting to make ripples in the water. So when they did this study, it was interesting in that they focused very much on the upper 2/3 of the neck. So, right up under the angle of the jaw, down 1/3, and they almost completely ignored the lower third. And yet everyone else in the literature has talked about the focus area must be the lower third of the veins draining the head, especially the jugular veins. So they ignored the area that has most of the findings, almost 95% of the findings. The other kicker, of course, why I talked about ultrasound in the first place, ultrasound is incredibly observer dependent. So you partly see what you want to see. So in growing up in Saskatchewan, my dad was a hail adjuster, so he traveled around all over the Saskatchewan province, and he always found it very interesting that the group of people that didn't have hail insurance almost always just got the hail on their garden and not on the field, which was, of course, their way of saying they didn't need hail insurance, but it just happened to catch their garden.
Right.
So people can see what they want to see, especially when you're using a very observer-dependent thing. The other important thing that most Canadians and Americans perhaps don't know is that ultrasound has been taken to a whole new level of expertise in Europe, and primarily we're not here yet. And so they negated or didn't use one of the very key pieces to finding the changes in valves and valve leaflets and so on that have been described and accepted at an international meeting that I was at in Bologna 2 years ago in Italy. It was accepted by a major conference of people from all over the world that these would be reasonable criteria, and then they didn't use them completely.
Dr. Bill Code with us. So, Bill, just in the moments remaining, when we look at and there's a lot of research still on the go, where do we see today, other than the view 2 years ago, where are we moving on the research field with liberation therapy and CCSVI?
Well, we're one of the best studies undergoing is, of course, the study initiated by Saskatchewan, which we talked about 2 years ago, and they're still underway with that study. I suspect there may be partway, maybe halfway almost on the entity, but we, of course, can't learn any details till it's completely done and completely unblinded. So that's going to be year two in the future. The other excellent rebuttal that many people may be caught was that, there's studies have been done, for example, at UBC by Dr. Tony Trabulsi in conjunction, my understanding, with the University of Saskatchewan, some of those patients and people. And he finds when you use the so-called gold standard, which is still the gold standard in most people's minds, of injecting dye into the vein, he touts it as being 60 to 70% of people with multiple sclerosis have these relative blockages. So we see quite a dichotomy, but for the first time we're starting to see people in that community coming out with information and data. Now, it's always so much easier to get this promoted when it's a negative study, because if it bleeds, it leads. I'm sure that's not a new term for you, John.
No.
So anyway, it works that way, but it creates a lot of furor and interest. But we're slowly creeping forward, and we're also finding increasingly that there's other areas involved, not just MS. So we're starting to look at it in other components of brain well-being, such as Alzheimer's, Parkinson's. But the new one on the block, to me, is traumatic brain injury. Because we don't have much to offer those people. And that's a really common problem everywhere, much, much more common than MS.
Good chatting with you as always. We'll keep in touch, and I know that in the next months and years we will revisit this again. Thank you so much.
Thanks again, John.
Bill Code, physician and an anesthetist originally, who, when he was diagnosed with MS, became involved in integrative medicine, and he is on the West Coast. We joined him on Vancouver Island this morning. This is News Talk Radio.